Joining us once again to answer your Facebook questions about the coronavirus is the Lieutenant Governor and the state's COVID-19 liaison, Dr. Josh Green. Good morning, Doc. Ready for the questions?
You bet. Good morning.
All right, the first question is from Christina. She wants to know, the flu vaccine is out. Is it safe to take both the COVID vaccine and the flu vaccine at the same time?
Yes, I asked that question. It's okay.
Okay, the next question is from Sherry. She wants to know, can those vaccinated develop long COVID after a breakthrough infection? And for people that are watching, what is long COVID, if you can explain that?
That's a very good question. So long COVID is having symptoms 3 months after you've had COVID. So let's go back to the original question. Can you get a breakthrough case of COVID if you've been fully vaccinated? Yes. The vaccines only protect you about 95% of the way, Pfizer and Moderna. So you still can catch COVID. Now, people have tended to not get nearly as sick, and people who catch COVID and have severe illness have had a lot of these long COVID conditions, meaning that they have extreme fatigue months and months after. Some people have headaches, body aches, and so on. So long COVID is a possibility, but by being vaccinated, you significantly decrease your risk of ever being in that situation.
And what about the people that are catching COVID? We talk about a lot of people are concerned about the kids. Do you have numbers on the younger generation?
I do. 15% of all of our cases have been under age 18 across the pandemic, but very few have been in the hospital. As I reported yesterday, we had 339 people in the hospital. Almost all were unvaccinated, 90%, and we only had 2 children in the hospital. Now, even having 1 child in the hospital breaks our heart, but it has been very rare, and that's why we're trying to hold the line on schools, be as careful as we can, but mostly the cases have been among adults, and the severe cases have almost all been among adults. Across the country, there have been fatalities of younger people, but again, it's very rare.
Jerry wants to know, with the 3rd booster shot being pushed, is it safe because it hasn't gotten FDA approval?
It is safe. It's again under emergency use authorization right now. So all of the shots have been under what's called EUA, emergency use authorization. The FDA approval is something that comes and is then almost never retracted. The emergency use authorization sometimes is adjusted. Now, it hasn't had to be in this case. You can safely get that 3rd shot, that booster shot, especially if you're immune compromised. That's individuals who are right now undergoing chemotherapy or they've had organ transplants. Soon we'll add that to our kupuna at long-term care facilities, nursing homes, as President Biden announced yesterday. And soon we'll also have the recommendation for everyone after 8 months finishing their vaccination. But the FDA approval actually is going to come, I believe, if not in the next 2 to 3 days, maybe by next Friday. It looks like before the end of the month, we'll have the full FDA approval.
Sandy wants to know, my mom has had breast cancer. She's a breast cancer survivor. Does she qualify to get the immune shot, the 3rd booster shot now?
Yes, she should go and get the shot today.
Does that qualify for a lot of our kupuna?
It does. And one interesting thing, Ross, has been the number of people in the hospital and the breakthrough case discussion. So also I reported yesterday, like I said, about 36 people in the hospital had been fully vaccinated or partially vaccinated, still got a breakthrough. But a lot of those people were our kupuna whose immunity has waned over the many months since they got their shots. Some of our kupuna got vaccinated back in January and February, and now it's been 6 or 7 months since they were vaccinated. Plus, people with renal disease and other ailments tend to have a less complete immune response. And that's why half of those people who had breakthrough cases in spite of being vaccinated and ended up in the hospital were very old with incomplete immune systems. So I think you're going to see everyone be able to get the booster shots. But my focus right now is the 200,000 or so individuals who are eligible for vaccinations in our state and who still haven't gotten it. That's where COVID is roaring through because of the Delta variant. And it's also going through our keiki who can't be vaccinated under age 12. So that's where we should focus all of our resources if we can. And I'm just humbly asking everyone to consider being vaccinated. Otherwise, we're going to still see high numbers both in the community and in the hospital.
And real quickly, I know you talked about it, that you visited Straub and you visited some other hospitals. What's been the biggest concern or complaint from the nurses, especially on the ER staff that you're talking to?
The biggest concern is we simply don't have enough intensive care unit staff to spread out across all of the patients. If a patient goes into the ICU, it tends to be 1 nurse per patient, and it's an exhausting amount of work to keep people alive. It's the best work to do, in my opinion, as a doctor, but we just don't have enough staff to take care of hundreds and hundreds of extra sick patients in the ICU. And so everyone is very worried about the coming surge from our 8,000 active cases. We're likely to get about 300 extra people in the hospital because 4% of all of our confirmed cases end up being hospitalized. We're going to have to weather that storm. Soon we'll come down the other side of the mountain of this Delta surge, but it can't come soon enough because our medical staff is really getting tired.
Hawaii County Mayor Mitch Roth, for example, wants pre-travel testing even for those vaccinated. What do you think about that and other restrictions being considered?
Well, I think we should consider everything. I really respect Mayor Roth, and that program, the pre-travel testing mandate, was actually a program that I was the principal architect for. So obviously I support that program. The question really is, where do you put your resources? Resources would be better spent on more nurses at this point. Right now, the biggest crisis we have is giving everyone access to care in our hospitals. That mostly means critical care nurses. The number of cases that are coming in from the mainland is very small, and most of those cases are our own returning residents who are unvaccinated and refuse to quarantine. No amount of testing, because people are not able to be forced legally to be tested, will stop that. They will still go into quarantine untested, and it will be the same problem. But if Mitch would like that, I think the governor should really respectfully listen to him because he knows his community.
Let's talk about bringing more nurses here. There will be more help coming in the next few weeks. You've been touring the local hospitals. Recently, you went to Straub. What have you found in terms of capacity as well as morale with staff?
Amazing people. The nurses are working double and triple shifts. They're extraordinary, but they've been doing it now for over a year. Right now, with the surge in hospitalizations, including Straub, they're working just too hard. So bringing in the 550 extra nurses and respiratory therapists over the next 60 days will make a huge difference, but we have to really support them, and therefore we have to do all that we can to vaccinate, because the only people that are getting severely ill are people who are not vaccinated. 90% of all cases have been among unvaccinated people, and the other 10% of those who had breakthrough cases have tended to not be as sick. There are a few exceptions to that rule, but that's what's grinding down the nurses, and out of respect to them and the doctors that are in the critical care units, we really have to honor that and get vaccinated. It's really tragic that something as preventable as this kind of severe illness is not being done amongst about 200,000 of our citizens. They have to get vaccinated.
And what about HSTA's concerns? Should a new agreement and guidelines for enforcement be made, or do you think schools right now are safe for kids and teachers? Because, you know, I'm a parent, you're a parent. I've received emails lately when there's a COVID case, and I know friends and family members who have as well, and it's very concerning.
It is very concerning. I absolutely think that the governor should sit down constantly with the head of HSTA, the DOE. All of them should be together all the time, including conversations with the Department of Health. I will say this, though. The pediatric situation has not been our main problem. We had 2 children, and any child being sick is a heartbreak, but only 2 children in the hospital as of yesterday, based on our early counts, as opposed to well over 300 adults. And children have tended to not get sick and, thank God, not passed away from COVID. There is a need to have education in person. The Pediatric Association across the country knows that if you don't get kids in schools, they don't get nutrition, their social development wanes, there are catastrophic consequences of not being in the classroom. So we have to balance that with any risk. But having said all that, I understand how worried teachers are, and they should be honored, and I will not criticize any parent or any educator for pushing harder for more rules, restrictions, and safety.
Now, the CDC just released a plan for vaccine boosters. Healthy adults can get it 8 months after their second shot. How much will a booster help protect people compared to those who decide not to get a booster? Say you've gotten your Pfizer, your Moderna, and you say, you know what, I'm going to stop for now. I don't want to get that booster. How much more would it help if you do?
It'll help a lot. We are now seeing that people's immunity begins to wane sometime 6 to 8 months after getting their second shot. You are still very immune. You're in an infinitely better spot than had you not gotten vaccinated. But this is what we often see with a lot of infectious disease, that you need an annual booster. And in this case, because we've had almost no immunity globally to the coronavirus, to COVID-19, the boosters are necessary. I will definitely get one when it's been 8 months, as long as the CDC and FDA have approved it. I got my second shot on Maya's birthday, which was January 11th. So sometime in September, I would like to get a shot. Healthcare workers all across the state will get a shot, and everyone should get a shot if it's recommended. You tend to see a 5 to 10 times increase in your immunity by getting these shots and boosters. There's also another thing people should know, and that's if they've had COVID, they do have some natural immunity, but again, they can get tenfold increases in immunity by getting vaccinated. So that's the real purpose here. We've now had just under 1 million people initiate in our state the vaccination, and about 900,000 complete it. So our immunity has gotten really extraordinary. We're third best in the country, but you still see this large swell of COVID cases because Delta is so contagious. So the more vaccinations we do, the better. And I'm going to continue to preach that, because if we don't get vaccinated, innocent people are vulnerable, and that's not okay.
Yeah, it is not okay. When you say innocent, a lot of kids are also vulnerable right now, too. They can't get the vaccine. So adults, we got to do our part.